This talk is about nutrition. If you want to cure cancer and many other diseases, you have to get nutrition right. So, Emar's talk is a particularly interesting one. And of course it's Emar Vogelaar, who runs the ELN Nagalase testing clinic in Bunnik in the Netherlands. But if you are sending blood off for Nagalase, do remember you have to go to a laboratory to get it spun down first. Dr. Emar Vogelaar.
Thank you, David, for inviting me.
Thanks, Emar. Thanks for coming.
It's a great pleasure to be here. The place was chosen by Professor Vogelaar, I heard. I was recently in Italy, in Verona. There's a group of doctors from the Philippines, medical directors of hospitals, and I had to give a presentation there in Italy. So we travel all over the world, if that's possible. I like traveling too, but I have no time to see the environment here. The next time I will do. It's nice to be here again. We have some news to tell about things we have done already. First of all, I go to the nutrition and the Nagalase testing. Nutritional testing is also extremely important in many diseases, and or to be healthy, or to have optimal health. And you need nutrient-dense food for that, rich in essential nutrients. So of course no sugar and things like that. I consider sugar a poison. So it's rich in vitamins, essential minerals, essential fatty acids, and essential amino acids. These are the real essential ones. There are at least 40 nutrients, which you don't make yourself, you need to get from somewhere else. But you have also semi-essential nutrients you can make yourself, but not everybody makes enough. And then you have to supply it too. Okay? You go to the next slide. This is the picture of the state of health. Oh, so what is going on here? This is the state of health on the nutrient. If you have almost nothing, you have the RDA. The RDA is the amount officially recommendation by the governments to avoid deficiencies, clear deficiencies, but you have a-specific symptoms above that and risk of diseases below the optimal level. And when it's optimal, if you get too much, it's not good either. The health goes down, it becomes toxic, except for some nutrients were almost non-toxic at all. And this picture is for each person a little bit different. But optimal health is where we have a right on, according to the many governments, but they do nothing about this. This most are deficient, and these are too much already now. Okay, we go to the next, cancer. In the white, you see all the nutrients which, if you have deficiency, they have an increased risk of cancer, or they can be used to treat cancer. The yellow one is a new one, and the red ones are toxic. They promote cancer. Also essential amino acids like vitamin. Most people get too much in many countries. These are some books from Professor Rubber describing all the hundreds of diseases where nutrition is important for, and that are not solving diseases. And here we have books about on nutrition here. It's a scientific book. This is a Dutch book where I wrote something in together with Professor Linus Pauling. So next one is the effect on the immune system. If you have a deficiency of one essential nutrient most of the time, see all these amino acids here, or all the vitamins, you have a diminished immune system. And the immune system is low pretty soon, and if you increase the deficiencies by taking sugar in the diet, you get the same effect. The The next one is the immune deficiency of all the trace elements here on the left side and right side, essential fatty acids and some also nutrients and substances. The next one is if you give too much, it can be toxic and the immune system goes down. So if you eat too much refined food, sugar and things like that, or you get too many toxic substances, your immune system goes down, even with the essential nutrients. But that is a broad range, but you have to be aware of that. And here you see the effect of some selenium, for example, vitamin A and C on the immunity. Here you see the Here is the RDA, it's a very low part, and here's the optimal level, and then it goes down in the immune system. But even here, it's much better than at the RDA levels. So before it becomes toxic for the immune system, you had to get a very big overload. Here is a clear picture of the effect of amino acids on the cellular immunity. And you see there are at least 15 amino acids needed for optimal growth. They are mentioned here on the bottom. So the growth diminishment is, if you have deficiency, it stops almost the growth of the immune system. And also amino acids, it doesn't matter so much. But you see all these 15 amino acids mentioned there are needed to keep your immune system running, the cellular immune system. Here I have an example of glutamine, has also many functions in the body, not an essential amino acid, and you see that it is have many functions. Here is the function on the lymphocyte, and here on the monocyte. So many functions. If you have a deficiency, too low levels is not good, but if you have too high levels, you get signs of ammonia toxicity. So you have the balance, the optimal in between. And that's, you can only know by doing some testing. In the case of glutamine, for example, you have an immunonutrition. For example, with omega-3 fatty acids, arginine and glutamine, cysteine and taurine. I go on taurine more in detail later. You can enhance your cellular immune system, improve the degradation of the tumor cells, modulate cytokine production, enhance lymphocytes, and enhance the macrophage proliferation, and also effects like wound healing improve them too. Okay. So you see these amino acids, besides the fatty acids, are important in immunity. And here I go down to the taurine. This is my favorite. Taurine reduces the peroxide and active oxygen formation in neutrophils and decreases the NPO activity. The taurine concentration is the most significant amino acids, free amino acids in the white cells. 76% is amino acids. Of the amino acids, free amino acids is taurine, which means it's 500 times higher than in the serum. So you can have only functional leukocytes and neutrophils with having enough taurine in there. The NPO generates this hypochlorite to form taurine chloramine. So binding of taurine with chlorine, and this is a bacterial substance, but is much less toxic than the hypochlorite itself. So it modulates the toxicity, taurine. Here you see the effect of taurine. Here, where it deactivates, it is one of the only antioxidants doing this. And here you have the white cell, a nice picture of it, and you see here hypochlorite coming out of the cells, is the myeloid oxygenase, and trying to kill bacteria or what else, or cancer cells, yes, hopefully. And that is only possible when you have enough taurine in the cells to keep the cells alive. Yes, the white cells do nothing if there's no taurine at all, or too low levels. Taurine is not only binding to chloride but also bromium and iodine. And the neutrophil NPO makes this hypochlorite, but also from bromide. And the eosinophils, they make preferable with bromium, the oxidative substances. Both are part of the innate immune system. Iodine is mentioned too, and maybe it has a big function too there, but I don't know, there's nothing known about it. Taurine forms both combinations with chlorine and bromine, and both induce the heme oxygenase 1, a stress-inducible enzyme with antioxidant and anti-inflammatory capacities, and it suppresses the production of NO, PGE2, TNF-alpha, IL-6, 8, and 12. And chemokines. And it does also activation of NF-kappa beta. So it does a lot of things you see here. Here you see the effect. And the effect, the chlorine concentration is the highest in the serum. So it is not shown here, but it's killing here at this end. But you see, bromine is killing at this rather low concentrations, and hypochlorite is the most effective one, but it's so toxic too. So that is what these cells do to kill bacteria. And here is the susceptibility is changing to different organisms. Taurine and cancer. Taurine is reducing the side effects of anti-cancer drugs and increases the effect of cisplatin. So you can use this as an add on the therapy. And in human cervical cancer cells, taurine decreases the cell proliferation caused by apoptosis, induction related to the p53 expression and activating of capsaicins 3, 6, and 7, and 9. And the human pathoma cells, taurine showed significant increase in cell density, and in combination with curcumin, which was mentioned earlier today, even better. Okay? Taurine is related to fat-soluble vitamins. The absorption of lipids and lipid-soluble vitamins is stimulated by in the bladder, the taurocholic acid, yeah? So it's in the bladder and helps the absorption of the fat-soluble vitamins. And it's vitamin A, D, E, K, and F. And also it's probably functioning in the body for doing the change of the fat-soluble vitamins to other parts of the organism. Taurine facilitates the transport of the water-soluble, insoluble vitamins and has a little bit similar spectrum of action because of this, I think, partly at least. Here you see the forms, the combinations. You see vitamin A is the taurine, and here you have vitamin D, also containing the taurine. So these are substances just existing in your body. And the taurine is water-soluble and helps to transport these fat-soluble vitamins. Okay, in order to summarize, so it inhibits the formation of hypochlorite, antioxidant function it has, it boosts the immune system, it is also an inhibitory neurotransmitter, which is important for autism, for example. It stimulates the absorption of fat-soluble substrates like vitamin A, D, E, and K. It helps also to control the cellular levels of minerals like potassium, sodium, magnesium, and calcium. It stabilizes the membranes for that. It is an epidermal osmolyte. It increases the vitamin C levels, increases wound healing, and it reduces surfactant-induced dry scaly skin by modulation of the pro-inflammatory response. Okay, and then Here, some other people, they mention even more functions. I will not go into detail, but you see it is important in surgery, but it's also, you see a loss in cancer and trauma and sepsis. So during certain situations, you have a big loss of taurine, and that's causing the health problems also. Besides this taurine, there is also for taurine, but also all the amino acids, there is biochemical individuality, which means that even in normal people already, there is a big difference in need. For example, if you see this one, this is from Professor Dr. Williams, medical doctor. He did the study about 50, 60 years ago, and he found the difference factor in need from 2 to 7, yes, so just in normal people. And that's happening with all the nutrients. You have differences in need by the person, and the laboratory testing may be a help to detect what is going wrong in the body. Because if you eat well, but if you don't absorb it, so you excrete it, you still don't have enough. One test to do is the amino acid testing, and during 24 hours is my favorite. You can do plasma too, but it's a little bit less sensitive and is related to the moment of the day. 24-hour during this complete 24-hour thing. You can detect deficiencies or disturbances in metabolism. You can see disturbance in protein degradation. You can see dysfunction of vitamins or vitamins. And you can see something about the flora of the gut. So this is just a few things you can see. And we find in the laboratory, in the patients, a lot of abnormalities, essential nutrients deficiencies, 40 to 50%, which you see also in many cancer cases. Too much, you see also dysfunction of intestinal flora, decreased protein degradation, reported in autism, for example, dysfunction of B6, very much magnesium, folic acid and B12 methylation problems, and magnesium dysfunction. And then finally, a lot of deficiencies in taurine. And then we go to the next one. Why is this loss of taurine and low levels in the body? One of the reasons is the increased levels of beta amino acids, and they are caused by gastrointestinal problems because of wrong flora in the gut, making the beta amino acids. And it gives an increased need for B6, and it causes, this beta amino acids, an increase of loss of amino acids in the kidney, especially taurine. So you lose more. And you make less because vitamin B6 is needed to make the taurine. So here you have low levels of taurine. It can be a cause of vitamin B6 dysfunction or deficiency. But also other amino acids are related to that, and too high levels of these amino acids is a sign of also B6 dysfunction. And here you see one substance, the beta-alanine, and the other beta amino acids, which gives this disturbance. And how does it work? Here, for example, you see from cysteine you go to taurine, and you need B6 to make this conversion. So if cysteine is higher normal, and taurine is lower normal, it can be dysfunction of B6. And that is also related to the other amino acids. And then you can still have normal levels in the blood, but this does not help you. You need higher levels to compensate for the dysfunction. Taurine homeostasis, you see it's in meat and squid. You can synthesize it from cysteine with B6 and also B3. It's used by the immune system, consumed and inflammation, so you need more if you have a lot of inflammation. And then you have increased loss when the beta amino acids are increased because, for example, of non-physiological microorganisms in the gut, because the absorption is diminished, reabsorption in the kidney. You know, the Spanish people say Taurus taurine, yes, to the bull, yes, to the animal, yes. But you know, there's people in Japan say taurine for squid, which you see in the next picture. I was in Japan one day, and you see, I cannot read Japanese, but I can read taurine here. This is squid. Delicious, yes, and healthy. Okay, now I go back to the next subject about some selenium. Selenium is extremely important to protect against cancer and slowing down the risk of getting cancer. And I was able to write some articles on that, invited by the director of the National Institute of Health in the Netherlands. And so I was advising 200 micrograms a day in the right form to prevent the risk of cancer, as long as our food is poor in selenium. And then, 10 years later, there was this wonderful article from Dr. Clark, who found that if you give the same amount of selenium in yeast to cancer to patients or persons, then you can reduce the risk of cancer and mortality with 50%. So these people didn't have cancer, had a high risk for it, but there was a gain protection by the selenium, the good selenium. No, sorry. Here, optimal selenium levels in the blood. It's not related to what you normally find in the blood, but you need higher levels. And here you see the levels at the top on the serum. Oh, sorry. This is serum levels, you see. For prostate you need the highest, but if you do it also in raw blood, then you need 200 micrograms equal to this level here. And according to Professor Strauser from the USA, you need even a little bit more. And if you have metastasis, you need probably higher levels. And some people give also high amounts of selenium to cancer patients with metastasis to reduce the amount of metastasis. Next one here, you have the effect of cancer and the essential fatty acids. So the omega-3 fatty acids here and primrose oil reduce the effect of cancer and give longer life. And the bad amino acids, bad fatty acids are linoleic acid and arachidonic acid, and they are increased with a higher risk of cancer, but also higher risk of cardiovascular disease, for example. So it's a bad thing, and people eat too much of the LA in their food today, omega-6 fatty acids, and eat too much agriculture meat, not wild meat from wild animals, and that is this is rich in arachidonic acid. You need about 20 micrograms of arachidonic acid, and in this food you get about 100 micrograms, so it's 5 times more. Cancer and amino acids, I give you here another example that it reduces the risk of Gc. Arginine improves the immune status, glutamine reduces side effects of chemotherapy, methionine restriction reduces the side effects of chemotherapy and stomach cancer, glutathione, which is also 3 amino acids together, is also very important to protect and carnitine. It's also an amino acid because it has amino groups and acid groups with complex ones. Here you see that if you have already Gc or hypoalbuminuria, which you can detect with PNI, so this is then you have wrong side if you have low levels. And you see it's difficult to get treatment of this effect because there are so many deficiencies in the cancer patients. And okay, so next one, we have the society in the Netherlands of doing nutritional oncology, and about 25 members you see here, and you can go to their website, and then it's some Dutch, but if you do what's standing here, click, Then you come on their website and they have about, today, I checked it on the 4th of December, 1856 articles about natural substances and natural methods, randomized control trials in cancer, which is not done so easily, but they are done often with regular treatment and this treatment. Yes, so that's more easy to do, but there are not many randomized control trials in the classical cancer. At least this is a lot of work, and these doctors who did it, we can congratulate them. They have all this scientific evidence. Okay, this is found in the randomized control trials, so these minerals can help, these vitamins can help, these amino acids can help, except methionine, whose restriction is needed, essential fatty acids, semi-essential nutrients help, and some herbs, just all the things, all natural methods is mentioned here. So, lots of possibilities. Methionine restriction, why is that so dangerous? Yes, it's already dangerous because methionine its restriction is important to reduce the oxidative stress in the mitochondria, and it is also increasing the homocysteine levels, which are toxic. And many people in the so-called Western countries eat too much protein, meat and things like that, 2 to 3 times what they need. And it's easy to adhere to such a diet, and you can improve your health and have a better quality of life and after methionine restriction, which is much more easy than dietary restriction or calorie restriction. And the simple thing you have to do, you change your animal protein to vegetable protein like pulses, lentils, beans, soya, for at least a big part, and don't stop the animal protein as much as possible. So it's rather easy. We saw here in the restaurant this morning they have a lot of beans too. Okay, vitamin K2 is extremely important for preventing cancer. These are studies from Professor Vermeer from the Netherlands, and he did population studies, and you see here on the right side here, you see the quartile of intake. This is the orange is the normal K vitamin, and this is the quartiles of the K2 intake. And you see the risk of cancer incidence, all forms, is reduced, especially with the K2. Here we can go to the prostate cancer index, also the K2 gives a lot effect, and lung cancer incidence also, only the K2 is doing it, and K1 is not doing much. And this K2 and K7 is the best. You can take 45 micrograms a day, and then you have also 3 to 4 years longer life and much lower risk of cancer. How the therapy is, I don't know. This is brand new, this research. You see, it was at a meeting we had in 2012. We have once in a while a meeting in the Netherlands, Advanced Clinical Nutrition. Now we go vitamin D. Vitamin D has a lot of effects on not only the fracture risk, but also risk of bone pain, muscle weakness, and pain, yes? Risk of cardiovascular disease, increased blood pressure, if you have deficiencies. Vitamin D improves the immune system and it decreases the risk of autoimmune diseases and reduces the risk of cancer. Everybody is afraid of going into the sunshine because you can get melanoma. Well, it's much you can save maybe 1 melanoma patient, but you save instead of that 100 also cancers by going into the sun. So don't be too afraid. You don't have to be too long in the sunshine because in the food is only 10% of your vitamin D, the normal food. And 90% has to come from the sun. Just 15 minutes in the sunshine during noontime is enough. In the summertime in the northern hemisphere